we call on to our next speaker, Dr. Gaurang Saigal. He'll be speaking on quantitative analysis of vitreous reflectance on OCT in different grades of diabetic retinopathy.
Laser pointer on the screen, please. Done. Just project. I've got this one. Okay. Very good evening to one all present here. Today I'm going to talk about a very interesting study done, which is a quantitative analysis of vitreous reflectance on OCT in different grades of diabetic retinopathy, the VRO study. So OCT has been a part of the ophthalmic imaging and offering high resolution cross-sectional images of ocular structure since the past 2 decades. But the OCT has not still been used for application in characterizing the vitreous reflectance. The vitreous itself, as we know, exhibits unique optical properties due to its compositions. It has been proven in some papers that diabetic vitropathy plays an important role in diabetic retinopathy, but it is yet to be studied in detail. So the aim of the study was to measure the intensity and distribution of backscattered light within the vitreous cavity and the structural alterations associated with diabetic retinopathy on OCT. To quantify vitreous reflectance on OCT imaging in different grades of diabetic retinopathy using the OCTA software, and also to study vitreous reflectance at a potential imaging biomarker. So first we had the approval, we did a retrospective cross-sectional study. We studied 200 eyes of 100 diagnosed diabetic patients. We took a consent. We excluded patients with myopia more than 6 diopters, history of any ocular surgery, trauma or GDM. And we evaluated BCVA, IOP, SLP, DR status. We did optos and with the OCT. So the analysis of vitreous reflectance was done by the OCTA software. So it is a software created by Doheny Image Reading Center software engineers in USA. B scans are imported from the Spectralis HRA OCT. Retinal thickness is regenerated using this software, and it allows the grader to manually draw or correct if the automatic segmentation is not right. It works on the principle of converting the pixels into micrometers, which yields thickness measurements. So this is how the software looks like, where you select the folder, images are imported back into the OCTA software from HRA OCT. The best B scan is selected, whichever we feel has the best quality. Then different layers are drawn, and after that, vitreous thickness, retina thickness, and reflectance are seen in this kind of a report. So the demographic data has 50 patients in 4 groups. First was no DM, no DR. The second was DM, no DR. The third was NPDR, and the fourth was PDR. They were age and sex control matched. So vitreous reflectance mean in log units was 204, the highest in PDR, 112 in NPDR, 140 in DM and no DR, and only 78 in no DM and no DR. Whereas the vitreous reflectance volume was also again found to be maximum in the PDR group, going to 12.46, and minimum in the no DM, no DR group to be around 8.42. The vitreous reflectance mean intensity was also found to be highest in the PDR group and lowest in the no DM, no DR group. The retinal thickness and intensity followed the same graph of the vitreous reflectance, and it was highest in the PDR group of 0.52, and it was lowest in the case of no DM, no DR. All these results were statistically very significant, whereas when we measured the NFL thickness mean and the NFL thickness mean intensity, though the values were higher in NPDR group in cases of NFL thickness mean, and they were higher in PDR group, these were not significant when we did the analysis. The RP cell layer thickness mean was also calculated, which was found to be higher in DM no DR group, and it was lowest in the PDR group. The RP cell layer thickness volume was found to be highest again in DM no DR group, and the RP cell thickness mean intensity was found to be highest again in DM and no DR group. So the RP cell thickness and mean intensity were highest